Hello, everyone. I'd like to welcome you all to our webinar today. My name is Bob Leone, and I'll be your moderator for this event. By the looks of things, we have a great cross-section of attendees from around the country and outside of the U.S. We have people currently working in global health, students, current and former Peace Corps volunteers, just to name a few. So again, welcome to all of you, and I hope that the next 60 minutes will prove enlightening and useful. We're also very excited to have a really, I think, interesting and seasoned panel of global health experts with us today. And I'll be introducing them shortly. As you'll soon see, they've all worked within USAID Global Health in some capacity and have now moved on to other endeavors.
Needs to switch the slide.
Please just make note of this slide before we continue. The contents do not necessarily reflect the views of USAID or the U.S. government, and it is protected by copyright. So I'd like to introduce our panelists to you at this point. First will be Gillian Eubner. She's a former Global Health Fellow of ours and is currently the Policy and Advocacy Director at the Lumos Foundation. Next will be Kathleen Rankin, also a former Global Health Fellow and currently a Program Officer in malaria with the Bill and Melinda Gates Foundation. And then next will be Jeffrey Spieler, who's a former Senior Advisor for Science and Technology in Population and Reproductive Health at USAID. And we'll be chatting with them all in just a few moments. So if any of you have any technical issues, you can use the Q&A function on your screen, which I will describe shortly, to submit any questions about, the technical issues that you're having. Or you can also use the number that appears on the screen right now. So you might want to take a moment and jot that down in case you need it later. So I'll just give you a minute to do that. And then this is the agenda for today's webinar. I'm going to very briefly talk about the Global Health Fellows Program, a quick overview. Then we'll go into our panelists' presentations, the three that I mentioned. There'll be a Q&A session at the end, and then we'll wrap up. And you have the opportunity to submit questions throughout the presentation, so please feel free to do that. And before we get into the presentations, a few quick housekeeping items. Closed captioning is available for this webinar. You may click on the Show Hide header in the Media Viewer panel in the bottom right corner of your screen to make more viewing room for captioning. If the Media Viewer window closes for any reason, you can bring it back by clicking on the Media Viewer icon in the upper right corner of your screen. Also, please note that a transcript of the spoken content will be available after the webinar, and there will also be a recording, and both will be available on our website, www.ghfp.net, about a week after this webinar, about a week after today. And then a word about the Q&A feature that I mentioned. You should have a Q&A panel on the right side of your screen. You can submit questions by typing into that box and hitting Submit to all panelists at any time during the webinar. We'll do our best to answer all of your questions. However, there may not be sufficient time to get to all of them. And finally, there is one poll question we'd like you to answer. Once the poll is announced, it will appear on the right of your screen, and you may make your selection. This is useful to us in terms of determining, how we would want to proceed for future webinars. And also, don't forget to hit the submit button so that your choice can be recorded. What is the Global Health Fellows Program 2? As the name suggests, it's the second iteration of a cooperative agreement with the U.S. Agency for International Development. And the Public Health Institute implements GHFP-II for USAID in partnership with several other organizations. So we work with an organization called GlobeMed, Global Health Corps, Pixera Global, and Faces for the Future. And each one of those partner organizations has a specific piece of the work that they do. Currently, we have about 110 active fellows that are on the program, and they're with us for 2 to 4 years. They work in a pretty wide variety of technical areas, including family planning, maternal and child health, reproductive health, HIV/AIDS, malaria, health policy, and other global health focused areas. The fellows work in the Global Health Bureau in Washington, D.C., or in one of the overseas missions, or with the USAID partner organization. And all of the positions that we have do require U.S. citizenship or U.S. permanent residence status. And one of the goals or the focus areas for our program is helping USAID to address immediate and emerging human capital needs by developing a diverse group of global health professionals to support and sustain the effectiveness of the agency's current and future health programs. In addition, we do have a very robust internship program. We have a summer cohort. And we also have on-demand internships that pop up throughout the year. And all of those openings, including the fellowship openings, can be found on our website at www.ghfp.net. So this is the poll question that I mentioned. This will be open for, I believe, 3 minutes. If you could please answer that question for us. As I said earlier, it would be helpful in terms of us planning for future webinars. And now I'm going to turn this over to Gillian Eubner, our first panelist. Gillian, as I mentioned, is the Policy and Advocacy Director for the Lumos Foundation. Welcome, Gillian.
Hi there, this is Gillian. Nice to have you all on the phone, and I'm trying to move the slides. There we go. So I was with the Global Health Fellows program for 5 years, in fact, and I was with USAID for a total of 6. And I worked as a child protection technical advisor, and I actually was based within the Global Health Bureau, but worked on an interagency mandate that was set in place through a legislative mandate called Public Law 10995. And it called for all forms of U.S. government assistance to children overseas to be comprehensive, coordinated, and effective. And the lead coordinating body was based within USAID. But we worked with 7 U.S. government agencies and departments and with 30 offices within them. The legislative mandate did not include any funding for coordination. So it was easier said than done, but a great challenge. I would say that one of my high points in that position was working across the government with interagency partners to develop the first ever whole of government strategic guidance for international assistance to children. That was a year-long process, and we launched it from the White House in December 2012. And actually the reason for developing that was not only in response to the legislative mandate, but also recognizing a real need for that kind of strategic guidance following the earthquake in Haiti, where we had 15 offices from 5 U.S. government agencies and departments working to respond to the needs of vulnerable children in Haiti without sort of a guiding framework. So the action plan really recognized the need to have holistic, whole-of-government strategic goals for our assistance to children. As I mentioned, the challenge was ensuring that U.S. government assistance was comprehensive, coordinated, and effective, and also measured so that we could track outcomes across the entire government over time and given the variety of settings that we worked in, and also the different cohorts that we worked with. The mandate was so big that we worked with children affected by HIV/AIDS, children who were separated as a result of conflict or disaster or otherwise affected by conflict and disaster, children living on the street, in institutions, trafficked, or victims of forced labor. So the mandate was really quite big, and trying to speak holistically about U.S. government actions and outcomes was quite a challenge. Important things to know. Well, I think in order to affect change, you really need to understand the system that you're working within. So this job was a really helpful place to be from my perspective. I had come from years of working with the United Nations and also NGOs in different countries, and I had never worked with the U.S. government before, so understanding how the U.S. government was set up and understanding the power behind it, but also the inefficiencies in some ways is very helpful. When you're working on a whole-of-government mandate and you don't have any funding, basically the only thing you have is your technical skill set in your relationships. So I think that working across agencies, really finding out what the motivations were, the interests, the various mandates, the different funding mechanisms, the different M&E systems, all of that really, really mattered. And that's quite difficult to understand unless you have good relationships who can sort of walk you through it and help you make connections where you need to. I think another thing that I learned while working with the government is that although many things do not happen quickly, the stick-to-itness really pays off. I mean, I sort of equate the U.S. government to a really big ship, and it takes time to turn it in a certain direction, but once you do, the turn is pretty significant, and it has a ripple effect outside of the government as well, which is something we definitely noticed with our U.S. government action plan, which is actually in some ways gotten more attention globally than it has within the U.S. government itself. Making the transition. I really appreciated the opportunity to learn how to affect change within a big bureaucratic structure. I mean, I had, of course, done a little bit of that with the UN, but I was in one country office with the UN and working with an organization as global and with as global reach as USAID, really learning how the structure worked mattered a lot. I think another skill that I learned, and this also, I guess I brought with it a little bit from a conflict resolution background, is the whole motivation of getting to yes. It's very easy when you're in such a complex environment and working with so many different and diverse partners to figure out why something won't work. But figuring out how to make it work and getting partners to agree on a yesable proposition, I think is a really important skill, and I've definitely taken it with me outside of USAID. And I think finally, USAID is also a really interesting place to be in terms of linking the science, the policy, and the practice. I was involved with an evidence summit that brought together leading academics from all over the world, as well as practitioners and policymakers. And that was an evidence summit on protecting children outside of family care. And it was very powerful, and the ability to convene all of those people in one room was very impactful. And what happened was that the lead U.S. government interagency partners agreed to develop a policy based on science, and they published that commitment to doing so in The Lancet, which is one of the foremost medical journals. And in that commitment, they said they would develop a policy within a year, which is what we did. And now it's, of course, a matter of putting that policy into practice and measuring the outcomes. And that goes back to the science. And so I really appreciate the sort of the whole cycle and the circle, and how one, the science can really influence the policy can really influence the practice, and vice versa. So those are the transferable skills, I think, really understanding how the government systems work. I've taken that with me outside of USAID. I'm now working for a private foundation that was established by J.K. Rowling. And knowing how the government works as we seek to change it and make it work better for children has been really, really helpful. So the goal of the Lumos Foundation is to end the institutionalization of children by 2050. And this is actually a very narrow piece of work compared to what I had been working on previously, because I had sort of a child protection remit writ large, and now I'm focusing on one aspect of the issues that I was working on previously, although I do very much appreciate and enjoy the ability to dive deep and to see change happening in one area, which is much easier when you're focusing on a number of countries and one cohort of kids versus every child protection issue globally. And the work that I'm doing now very much involves working closely with U.S. government partners, which is great because I'm able to continue to spend time with the colleagues that I worked closely with for years. And we're, of course, working with the United Nations in country, but also at the global level. I work a lot with faith-based partners because so many of the institutions, or better known as orphanages, around the world have been established by faith-based groups and supported by faith-based groups. And because of our founder, I actually have the pleasure of working with Harry Potter fans, and I don't do a lot of direct work with them, but our communications team certainly has a reach into these many networks, actually, and it's interesting to see how global this network is and how powerful in its own way. It's a really interesting way of looking at population level behavior change across a generation. I think, just to explain a little bit more, the work of deinstitutionalization. We don't know exactly how many children are living in orphanages around the globe because they're not counted, and our population surveys never include them because our population surveys are household based. But we know that there are at least 8 million, and that's probably a very low estimate. And what we also know is that the vast majority of children who live in orphanages are actually not orphans. 80% of them have parents, and they're generally placed there because of extreme poverty or disability or other issues, social issues that can be addressed at the community and family level. So the goal of Lumos is to ensure that children who can be reunited with their families are, and that the care systems are reformed so that services are provided to children through their families and communities and not through institutions, where we know the impact on children is quite negative and irreversible at times. Well, I'm there. Thanks very much.
Well, thanks very much, Gillian, for that piece of the presentation. It was really interesting, and I did have just one sort of follow-up question for you. The work that you do seems, very complex, and a lot of sort of opportunity to feel like it can be overwhelming, at least from my point of view. Is there something that sort of really keeps you on track and motivated and kind of up for the work?
That's a great. I don't know if you can hear me. Sorry, the ball has not yet moved back to me.
Oh, hold on.
I guess you can.
Oh, there you go.
Okay, sorry. What keeps me motivated? Well, I mean, I think the first thing I would say is my experiences in the field definitely keep me motivated. I was in Angola and Sudan for 5 years during the conflicts there, and seeing children who've fallen outside of family care for various reasons was very impactful. But then also being involved in the reintegration work of former child soldiers, for instance, getting back into their communities and with their families after really living through hell. That was very formative. It really left an indelible mark on me, I think. And also I'm a mom, and I have done a lot of work in child development and been trained in that. And, it's not that complicated to give children what they need when families are supported. And just having that sort of daily grounding of working and being with my own kids, and recognizing, the supports that I have that I think we tend to take for granted when we're living in a society like ours, although Lord knows there's more to do on child welfare and protection in this country too. But to me it's sort of a life piece of work at home and also fortunately professionally. But I think that the experiences from the field and working directly with children and then working with my own kids is really what keeps me going, for sure.
Great. Well, thanks very much, Gillian, for putting that into perspective for us. And then moving along, our next presenter is Kathleen Rankin, and she's currently with the Bill and Melinda Gates Foundation as a malaria program officer. So welcome, Kathleen.
Thanks very much. It's really nice to be here. As Bob said, I'm now at the Bill and Melinda Gates Foundation, but when I was with USAID as part of the Global Health Fellows Program, I was working as a Malaria Research Advisor for the President's Malaria Initiative. And when I took that position, I had been at USAID for a year working as a AAAS Fellow, so I had made the transition from really bench science, so actually doing, liver stage malaria research, so really basic bench, pipetting and Eppendorf tubes and microscopes and all of that stuff. I made the transition to doing development work, essentially, and was in the Middle East Bureau for a year, and then got this opportunity with the President's Malaria Initiative. So this was a very interesting and also challenging position in that I was the operational research coordinator for the initiative. The initiative is an interagency effort led by USAID, but that has CDC as a key partner and implementer. And the research piece had, it's primarily an implementation initiative. It's not primarily a research program, but operational research is basically understanding how your implementation is working, and are there better ways that you could be implementing. So it's sometimes testing new approaches, it's sometimes testing changes to current approaches or combinations of interventions and seeing whether they work better or if there are better ways to do things. So for me, this was it was an interesting combination of my technical background, science-wise, and with administrating research programs, which I had done a bit previously, as well as a more strategic overview of a program as a whole, looking at the pieces the types of interventions that PMI was implementing, as well as some of the other options that were out there, and trying to figure out, helping provide data, evidence base for making decisions to potentially incorporate new interventions or, shift how certain interventions were implemented. So one of the big challenges for me, and it was a challenge but also ended up being really gratifying, was helping to and really leading the development of the strategic guidance for operational research, which served a couple of functions. One was really to provide guidance for decision making in terms of what types of research were appropriate for PMI to fund and what were not. Because there are always interesting and important research questions, but in terms of the questions that are really relevant and crucial for improving implementation, you can actually narrow those down pretty significantly from the wide world of things that are interesting and would be nice to know. It's sort of going from the nice to know to need to know. It also helps to provide a lot of guidance, both guidance to the resident advisors for PMI that were in country, but also got a lot of input from them on what were things that they needed to know in their particular implementation context that would be really helpful. And I mean, PMI is really interesting in that it's in a really wide range of countries in sub-Saharan Africa and the greater Mekong subregion, and the malaria situations vary widely. You have countries that have made really, really good progress and have brought their malaria incidence down quite low, and then you have countries where the prevalence is still incredibly high. So you have in the research questions and the questions that need to be answered in those countries are vastly different. So providing some guidance for both for the in-country teams and getting input from the in-country teams was really key for that, as well as providing better guidance for prioritization within the initiative. There are so many questions that need to be answered, but we can only answer a couple usually. And it really was helpful to have this strategic guidance. To say, okay, when you have 5 questions, how do you narrow it down to the 1 or 2? How do you prioritize? Figure out what the priority should be. So it was really, and I had never really been part of that kind of a strategic thinking process and a strategic decision-making process like that before. So it was a challenge to do it and to help to lead it, but ended up being very gratifying when you have a solid document at the end of it that's actually helpful that you end up going back and referencing over and over again. It's really, really quite gratifying. So one of the biggest challenges, I think, overall was just for me the complexity of it, and both in terms of USAID as an organization and within PMI, the interagency structure. And I would say the thing that I realized pretty quickly is that it takes time to learn the organization, to learn the funding structures, just to understand how the U.S. government works in that particular space. It takes time, and I felt like I was with PMI for 2 years, and I felt like I was absolutely still learning things even up to my very last day. So just giving yourself the time to figure that out and really making that a priority, because it's pretty easy to get overwhelmed with all of the tasks that you're expected to do. And the other thing, and this is true for me, and probably has always been true for me, is to not be afraid to ask stupid questions or what you think might be a stupid question, because usually it's not. And, it's usually something that seems like it should be obvious, but it's not. And if it's not obvious to you, then it's probably not obvious to others either. And then one thing that I really, really appreciated with my time at USAID was basically the ability and the opportunity to build really solid relationships with colleagues. That really made the complex and difficult work both possible and, at least sometimes enjoyable. It was, the group of people that I was working with was just phenomenal, and it was a really, really good opportunity to build those working relationships and use those relationships to help move things forward, both at USAID and at CDC. And I would echo Gillian's comment about persistence and stick-to-itiveness. It takes a lot of time to enact any kind of change in the government, but then once that happens and things start moving forward, it can really make a big difference. So as I mentioned, I transitioned from bench science to global health, and I did that via AAAS. Well, so I transitioned into development via AAAS Fellowship at USAID. So I was in the Middle East Bureau for a year, working on a peer-reviewed grants program that funded applied research that were cooperative projects between Arab and Israeli scientists. And it was some health projects, it was some some agriculture projects, some water projects. It was really a broad range of subject areas, and it, basically I learned that I am able to, get up to speed pretty quickly on, just given my overall science background, on technologies that are not my specific area of expertise, but that I can quickly understand and understand well enough to be able to ask the right questions about grants and understand how those, basically, are projects going well? Are they not? If they're not, what can we do to fix it? And then I was given this opportunity to transition from the Middle East Bureau to the Global Health Bureau with PMI, and that was really, I missed working on malaria. I had worked on malaria as a bench scientist. I really found it's a fascinating disease, and it has such a huge impact in the developing world that it was a no-brainer for me to make that transition. And then I was planning on staying with PMI, and then my partner got a job offer in Seattle, and it was just, we had been in DC for my job for several years, so it was basically his turn for us to move. And I, again, got this opportunity at the Gates Foundation to work with the malaria team here. And things that really helped with making the transition out of USAID, one is the fact that I am still working, the malaria community is pretty small, so I'm still working a lot with my colleagues from PMI, which is wonderful to be able to continue to do that. And then USAID plays such a huge role in how programs in the developing world are funded, that it's really incredibly helpful to understand how that works, why it works the way it does, where are the points in that process where you can influence it. All of that is really invaluable in moving to a partner organization. And then, so here at the Gates Foundation, I work as a program officer, which means that I essentially have a portfolio of grants that I am the primary point of contact for, and I also work with the entire team to help shape basically shape what our investments look like going forward. So the malaria strategy here at the Gates Foundation currently is basically all about accelerating to zero. So it's both using the current tools that we have and using them in new ways to try to accelerate the incredible progress that has been made to date in terms of decreasing the malaria burden worldwide, as well as investing in new tools that will likely be transformational in terms of our ability to actually ultimately eliminate and eradicate malaria. So it's the piece that I'm really focusing on among all of our investments are the implementation or operational research pieces. So these are, the projects where you're really, have a particular intervention or a particular technique and you're trying to apply it in country and see what the impact is, or if there is impact. And then in many cases comparing it to current interventions that are done in traditional ways or other things of that sort. So there's a lot of continuity between what I was doing at USAID and what I'm doing here. It's different in that the foundation really does fund a lot of research. So whereas USAID is really an implementer in the malaria space, we're much more a research organization. So then the thing that I'm finding really interesting and fun is figuring out, really focusing on how can you make the research that we're doing the most relevant to the implementers. So how can we have the research that we're funding really feed directly into the ability to implement these new strategies using current tools. So I think I'll stop there. But like I said, I think again this goes back to Julian's point of linking the science, policy, and practice. That continuity at USAID is really unique. And getting experience with that and understanding that, I think, really puts you in a good position to then move on to something else that might be focusing more on one of those pieces, but having that really coherent view of the whole, I think, is very helpful. So, thanks.
Well, thanks very much, Kathleen. And I really appreciated your talking about, sort of how you made that transition from the bench science to what you're doing now. And that actually comes up a lot when we do sort of career development with people. A lot of times people will ask us how they can sort of make that transition. So I'm wondering if you have any other sort of additional tips for people about, that have kind of been in that situation and are looking to kind of make that leap.
Yeah, I mean, it's not an easy or intuitive leap to make, basically. And what I figured out when I realized that I wanted to make that leap was that there's no one way to do it. There are lots of ways that, in theory, there are a lot of ways that you could do it, but in practice, people do it just sort of a couple of ways, I think. One is through the AAAS Science and Technology Policy Fellowship Program. That's a big, many of the people who had made that transition, who I spoke to, highly recommended that, and I would echo that recommendation. And that having that 1 or 2 year experience in the federal government, and honestly, even if it's not global health work, doing something where you get field experience, where you get implementation experience, that makes that transition to doing global health implementation that much easier. Because if you have a sort of a general health background anyway, you have the health bit, it's the development bit that you need. Another way is through the CDC Epidemiological Intelligence Service. That's a way that some people make that transition. And again, that's it's a sort of bounded program, and a lot of what that does is help. It's obviously very good technical training, but then it really helps you build your network. And those are sort of the two main avenues that people that I talk to did it, and the people that I know who have done it subsequently. Those are sort of the two main things. But it's really getting that developing country experience and having some evidence to show that you. I think the issue with transitioning from doing more bench science or hard science into the more global health arena is that it's not obvious that you know how to think outside of your specific science area, and so finding some way to show that you are able to think beyond that, and you're essentially using your science training, but are very able to apply it to a broad area or a broad spectrum of things is really, really key.
Okay, well, thanks so much, Kathleen, for kind of expanding on that. And so we're going to move along to our next presenter, Jeffrey Spieler, who is a former Senior Advisor for Science and Technology, Population and Reproductive Health at USAID. So we're going to turn it over to Jeff. Welcome, Jeff.
Thank you. Well, it's indeed a pleasure to be part of this webinar and to join Gillian and Kathleen on this panel. And interesting that Kathleen ended about the AAAS Fellowships, which is the American Association for Advancement in Science. And in my years at USAID, I had numerous AAAS fellows, and many of them became direct hires. And although that's relatively rare, that was their avenue into getting into USAID. And I ended my career at USAID as the Science and Technology Advisor in Population and Reproductive Health, and I had numerous roles. But I'm probably one of the only people who worked at AID who stayed for more than 25 to 30 years, who only worked in one office. I spent my entire career in the Office of Population, which became the Office of Population and Reproductive Health. And I should say that I began my career in science as a bench scientist at a pharmaceutical industry called Letterly Laboratories in Pearl River, New York. And I was interested in contraceptive research at that time. So I also went to graduate school at that time at Rutgers State College in zoology and reproductive biology. I was avoiding the Vietnam draft by working in a pharmaceutical company and also following my bliss. So at AID, which I joined in 1983 after 11 years in Geneva at the World Health Organization Human Reproduction Program, where I started working internationally starting in 1972. I joined AID in 1983 as a biomedical research scientist, and throughout my career I worked my way up. I became as a direct hire and I worked my way as a division chief in the research division, which became the Research Technology and Utilization Division, and I stayed in that division until 2007. I became the chief in 1991, and I was the chief until 2007 when I became the science advisor in Population and Reproductive Health at USAID. I no longer wanted to be a division chief at that time. My career high points have been many. I've really been blessed by having had the opportunity to work in this field for so many years, and I've listed a couple of my career high points. One of them is that I made the risky decision, for which I got a lot of flack from other governmental agencies, to support a research study on the use of tenofovir gel as a microbicide to prevent heterosexual transmission of HIV/AIDS. That was the CAPRISA 004 study, and that resulted in the first ever proof of concept that a vaginal microbicide made of tenofovir gel could actually reduce the risk of HIV acquisition for women, and surprisingly, it also cut the risk for HSV, herpes simplex virus, by 50% in that study. So that was really it was a high point for me because I received a huge amount of flack for having supported that study when other governmental agencies thought there wasn't enough data. And my philosophy has always been, if you don't take big risks, you can't have big wins. The other major career high point for me was years and years of working on research to put the very popular injectable contraceptive called Depo-Provera, or DMPA, into the Uniject system, which is a single-use, very novel injection system developed by PATH with USAID funding. So we put Depo-Provera and the subcutaneous formulation into Uniject. The product is called Cyanopress, and that has now received approval by stringent regulatory authorities, and the product is currently being introduced, and it will be a real game changer in the contraceptive field because it offers the opportunity for self-injection. And there's current research projects going on right now that will look at the ability of women to self-inject this product, for which I'm quite sure that research will be very positive. I also was very much involved with the Gates Foundation, the original Gates Foundation, not shown on this slide. That was run by Bill Gates' father. Bill Gates is actually Bill Gates III. His father is the second, and he started the Gates Foundation. And I discovered maybe in the mid-'90s that cervical cancer was actually a sexually transmitted disease caused by HPV infection. There's 4 oncogenic types of HPV. And when I made that discovery, I really was shocked that I had never realized that until the mid-'90s, and got very involved. And working with the original Gates Foundation, I was instrumental in helping to raise $50 million for 5 organizations to create the Alliance for Cervical Cancer Prevention, which has demonstrated the importance of visual inspection with acetic acid for identifying lesions that lower-level healthcare providers can use to determine a woman's risk for cervical cancer, which is an absolutely terrible disease. So moving on to my challenges and finding success. At AID, I had numerous challenges. Working in a governmental bureaucracy managed by Congress, which is absolutely shocking, and coming from an international organization like WHO, where surprisingly our level of oversight was much less than at USAID. It was really a difficult environment with congressional oversight to work at AID. So so I had many challenges when I joined AID in 1983 after 11 years in Geneva. And one of my challenges, which I'd like to share with you, had to do with figuring out how you succeed in the presence of an environment which doesn't necessarily want to collaborate. And to make a long story short, I had to deal with a political appointee who was a general counsel at USAID, and I was involved in awarding a new cooperative agreement with an organization that had previously been involved, a new U.S. organization that had previously been involved with abortion-related research, which, as many of you may know, that since 1974 the U.S. government cannot support anything related to abortion. Well, this organization had previously worked on abortion, and we were all trying to award a new cooperative agreement, and our general counsel said, no, I'm not going to sign off on this. And I went to visit that general counsel political appointee, and his decision not to sign off had nothing to do with the quality of the work being done, but had to do with the fact that they had once been involved with abortion research. And I ended up having a incredible argument in the head of the general counsel at USAID's office, and he wanted to kick me out of his office because I had accused him of making the decision to not support this for political reasons, not for scientific reasons. And I said, we can't run USAID with making decisions because of politics. We have to make them based on science. So he tried to kick me out of his office. I refused to leave, and I said, I'm not leaving until we resolve this. And when I finally realized that I was going to make no headway with this guy at all, and I had to use other networks to get this project approved, I left the office. And on my way out of his office, all of the staff of the general counsel's office, which were assembled outside because they heard the shouting and screaming, thanked me so much for having the guts to argue with the general counsel, who many people in the general counsel office had quit because of him. So I then, and you'll see later on in my presentation, one of the important ways to get ahead is through networking. I then went to the head of procurement, who happened to be a friend, and I explained what the problem was. And he said, forget that guy. I'll sign off on this agreement completely. We don't need his signature. And the project was awarded. So that was a huge challenge, and I overcame it largely because of networking and knowing who else I could turn to that would recognize that my position was correct and the general counsel's was not. Moving on to things that you need to know about being successful in an organization like USAID. One is, in my experience, was be prepared to do whatever needs to be done to get the job done, even though the job being done may not fall within your position description and may require extra hours for which you're not going to be paid, in other words, working at home. But it's really critical to succeed that you're prepared as a professional to do what's necessary to get the job done. The second important thing to know about being successful in an organization like USAID or any other large bureaucracy is that you have to accept and live with ambiguity. Well, what does that mean? It means the fact that sometimes you're going to be given an assignment by your supervisor, and you're actually not sure of exactly what is being asked of you. And even though you should be asking for clarification, what do you need me to do to make sure that I do the job correctly, you're not going to be told exactly what you need to do. Your supervisor, whoever you're reporting to, will know what they don't want. However, they don't know exactly what they do want. So there's a ton of ambiguity in an organization, and if you can't live with ambiguity and you're completely left-brained, it's very difficult to succeed in an organization. You just have to expect that every day when you come to work, what you plan to do is not necessarily what you're going to do, because you're going to get other assignments, and you're going to spend a lot of time putting out fires and putting out fires in areas that you didn't think you would have to be working in. The other thing I would like to mention is learning to manage up. What does that mean? That means that you may have a supervisor who is a team leader or a division chief, and you need to make sure that you satisfy their needs. However, you may get assignments, whether you work at AID or anywhere else, from people at a higher level than your team leader or your division chief, for instance, an office director or an assistant administrator. And you need, in my view, to succeed in an organization, a large organization, you need to figure out how do you satisfy the needs of the highest level person making requests to you, as well as, of course, satisfying the needs of your immediate supervisor, who's going to be responsible for your annual evaluation. So thinking about, how do you make sure that you satisfy people who are levels above your level is really critical to succeeding in a large organization. Moving on to making the transition. So I retired from AID after 31 years of working there, and I knew it was time for me to retire. It was time because my personal circumstances, having lost a wife of 44 plus years, and realizing that there's so many other important things to do besides working. As you guess, of course, I'm the most senior level person, or let's say the oldest person on this panel, as well as our moderator. I just had my 70th birthday. And last year I realized that life's really short, and if you don't spend time doing things that are really important to you, you may never get around to them. And work largely interfered with my time to do other things. So I realized it was time for me to retire. And my exit strategy was to spend at least 2 weeks figuring out what I needed to take home with me and what I could throw away and what I need to pass on to other colleagues, and doing my best over the last year before I retired, mentoring other colleagues to take on some of the work that I was responsible for, so that somebody would continue that work. And later I'll talk a little bit about what I'm doing now. But during my years at USAID, I acquired several skills that I would like to pass on to the participants in this webinar. One is the critical importance of networking. You really need, wherever you work, you need to get to know everybody you're working with, and you also need to get, you need to become aware of people in other areas within your organization with whom you need to work, as well as other people in other organizations who are doing similar work to what you're doing, so that you're really well networked with your colleagues in both your own organization and other organizations. And that networking is really building personal relationships that will result in success in your job and also happiness in the workplace. Another important aspect of working in an organization is teamwork. There is very little that is done by an individual. Very little. Most of the work of most organizations is done through teamwork. None of us have the knowledge, skills, and ability to do every aspect of the work. And working as a team member and pulling your own weight and figuring out how you contribute to a team and how other people contribute is really critical to success. It's a very important skill. And in my experience at AID for 31 years, those who could not work well as a team member and who really want to work alone did not succeed well. AID was not USAID was not the place for them. The last thing I'd like to mention is this issue of finding balance between work and home life. I was really unsuccessful in doing that. So I ended up working like 60 hours a week. I never neglected my family, but I just worked too much. And I'm really proud of colleagues who I've mentored who have figured out that, look, work is not the only thing. I need to put my full 40 hours and maybe a little bit more in, but I need to have my personal time. I need to turn off my computer when I'm on vacation and not accept any emails, and I didn't know that, but I would like to suggest to everybody that's a really important thing to do. There is life outside of work, and you need to recognize that. Life is very short, and you need to take advantage of all the opportunities you have outside of work to have fulfillment. While that question really dealt with non-technical skills, I'd like to make a recommendation about something I learned at AID. The fact is, if you want to stay on top of your technical skills, you may need to read professional journals, articles. You may need to do writing outside of work on your own time. And while that is the antithesis of work-life balance, the fact is you can't get it all done in a 40-hour work week. So I would suggest to anybody who has technical skills, you got to keep those sharp. You need to stay on top of your technical skills, and you need to learn new things whenever you can.
So I'd just like to jump in here for a moment, if I could, Jeff, and I really appreciate that piece about the work-life balance. I think that's a great one for people to keep in mind as they're moving through their careers. So we only have about 5 minutes left, and I'd like to get to a few questions if we could. So if you could wrap up, that would be great.
Fine. Great. Okay, so very quickly, my current work, I decided that I was going to retire in December. And I did retire December of 14, but I didn't go cold turkey. I agreed that I would do a little bit of consulting for my office to complete some of the things I'm working on. And this slide shows several of the things that I'm currently doing for the office. And I don't think I'll do much next year. I really need to step away and pursue other important things in my life. Thank you.
Well, thanks very much, Jeff, and I really appreciate your sort of really broad breadth of experience and your willingness to kind of bring us into some of the things that you've been involved in your career. So moving along, we do have a few questions from the panel for the panelists. There's one here. And whoever feels like they would like to take it is fine. After having a USAID contract, how easy is it to network into another position at USAID? Is there anybody that would like to take a crack at that?
So the question is, after being supported by AID under a contract, how do you get to be a USAID employee? Is that the question?
Well, that's what I'm guessing is the gist of it. Into another position, I guess, a direct hire employee.
Yeah. Well, AID is really. I started running a division and I had 13 direct hires, and at one point I was down to 4, and the rest of the office was contractors, either Global Health Fellows, Michigan Fellows, or other mechanisms. And it's AID doesn't have enough direct hire positions. And it's really hard to transition, and the only way you can move to a direct hire position is to watch the careers at USAID.gov or USAjobs.gov and find direct hire positions. But most of the people working at AID, well over 50%, are not USAID employees. They're contractors.
Great, thank you. Here's another question. I'm an MHA student, UNC Chapel Hill. I'm a lawyer with no health experience. What steps should I be taking so that I can be in a good position to not only begin my career in health, but also be a good contender for the Global Health Fellows Program?
Get an MPH.
Okay.
That's
great.
My suggestion. An MPH will open job for half the jobs at AID. An MPH without really strong, specific technical skills will get you in the door.
This is Kathleen. I totally agree with that.
And this is Gillian, and I would say I was probably one of the few people working in the Global Health Bureau without an MPH. But I have a child protection and development background, which is what I needed to do my work. And a lot of child protection has to do with law. So there are many lawyers working in my sector as well. So I think the the question is to know what you want to do and then develop the appropriate skills to do it. But I don't think global public health background is necessary for every single area that we work in, although it's certainly helpful.
Yeah, an MPH isn't needed for a specific technical specialty. But in the absence of a technical specialty, the MPH opens the ability to work in many areas and learn new skills and work in other technical areas.
Great. Well, thank you all for those answers. We're just about out of time. So I would like to thank again the panelists so much for taking time out of their busy schedules to be with us today, and I really appreciate the fact that you were able to I think give people some great insights into global health and into your particular career paths and what it was like to work at USAID and beyond. And also I'd like to thank all of you out there who attended the webinar today, and also we would like to remind you that we do informational interviews by phone, and you can sign up for those if you'd like on our website at GHFP.net. And basically we'll connect you up with one of our staff people, and you'll be able to talk about your particular career issues. So once again, thank you very much, and have a great day.